There are many different ways to get the sample of a spinal fluid through a lumbar puncture. It's commonly called the spinal tap. It's the most common method for collecting any cerebral spinal fluid, the CSF, that surrounds your brain and it surrounds your spinal cord and it acts like a cushion. It protects the brain and the spine from any injury. The fluid is normally clear, and the tests usually are performed with the patient laying on his or her side with their knees pulled up toward the chest and the chin tucked downward. Sometimes the person is sitting or bent over. After the back is clean, the doctor will inject a numbing medicine into the lower spine. The spinal needle is inserted, usually into the lower back area. Once it's properly positioned, the spinal fluid pressure is measured and the fluid is collected. Once the needle is removed, the area is clean and bandage is placed over the needle site. They are often asked to just lay down for a few minutes after the test. The patient or the patient's guardian must give permission to do the test. It may be an uncomfortable position, but it's important that the patient stays in the bended position to avoid moving the needle and possibly injuring any part of the spinal cord. The numbing medicine will burn or it will sting when it's first injected. There will be a hard pressure feeling when the needle is inserted, and there's usually some brief pain when the needle goes through the tissue surrounding the spinal cord. It should stop within a few seconds. The discomfort is minimal. Usually the entire procedure takes about 30 minutes, and the actual pressure measurements and fluid collection only takes a few minutes. Once the test is done, the measured pressure within the cerebral spinal fluid collect sample, and it can be used to diagnose any certain neurologic disorders, or particularly any infections such as meningitis. It will collect the sample fluid for any further testing. And once again, it can be used to diagnose any certain neurologic disorders, such as any meningitis or any brain and spinal cord damage. The risk of a lumbar puncture, you can have hypersensitivity to the medicines, discomfort during the test, you can have a headache after the test, and bleeding into the spinal canal. If you're taking any blood thinners medicine, it will increase your risk of bleeding. Brain herniation, it could occur if this test is done to a person with a mass in the brain, such as a tumor. This can result in any brain damage or death. The test will not be done if any other exam reveals that there is a brain mass. You can have damage to the nerves in the spinal cord, especially if the person moves during the test. That's why it's important to stay still during the test.